Hi, I'm Jessica Bland. I'm a senior researcher at Nesta. Today's workshop on data, health and me was about bringing together people with really diverse knowledge, people who know a lot about data and big data sets and how to analyse them, and people who know a lot about the NHS and about health services and about health technologies more generally. Over the course of 3 different kinds of workshop, we tried to talk about what this might look like in a decade's time, how these different areas might come together, either in a kind of dystopian way, possibly giving us a future where everyone purposefully gives themselves diseases in order to sell their data for more money to pharmaceutical companies. Or, on the other hand, a future where we solve a lot of the big global health issues of today because we have much better data sets about all of us.
I think it'll be really interesting to see people's prejudices and expectations about wearing devices publicly, being self-conscious about their data and other people seeing that they're wearing new devices. It makes quite a statement, you know, to be wearing something odd on your body.
In this scenario, this is a MIDI Hex which collects various vital signs constantly, and everyone has to wear one of these. And this is a new product called the MIDI Block, which allows you to block all or some of those data streams.
And this is the MIDI filter, which allows you to customize exactly what you permit to be shared when.
This is a biometric data collection device. It's crucially important because it uploads my data privately to my own personal data vault. I can share that with those who I select, my friends, my family, selective practitioners, or a group of people who I'll trust with my data and they'll trust me with theirs.
The experiment was fun. It definitely made you, it sort of took you out of your comfort zone really, and made you think about things that otherwise you wouldn't have considered. So going out and actually testing these devices and thinking about how it made you think or how it made you feel and what other people would think of you if you were wearing something that was so visible on your chest, etc. So I thought it was a really interesting format.
The device I have is called the MIDI Hex. It's a way of translating your personal vital signs into data you can own and share on a global marketplace. It all begins here with this wearable technology, which tracks various vital signs. Then what happens is you're able to transmit by means of a biometric identification and this box your data into a global marketplace. You can sell it and receive health coins. And you can also see in real time the price you might get for various sorts of data from different vendors or buyers.
So the new organizations that are coming through didn't exist just a couple of years ago, and they're being created in response to the fact that it's through the use of wearable technology and apps and sensors, it's now possible to collect data on our health, on our bodies, in between visits to the NHS, which is how data is collected on us at the moment. I predict that there's going to be more and more startups who are going to be popping into this space of personal data marketplaces or patient data cooperatives.
I think when it comes to wearables, there's some new things for me to think about. One is how fashionable they are or shouldn't be. I mean, the healthcare benefits will come from having long-term data collection, and there's a danger that what's happening at the moment is fashionable and it will pass, and that will be a lost opportunity. I think there is a danger that we could create a 2-tier society, that there'll be a part of society that have data and part that don't, and that will get worse and make the difference between poor and rich in terms of healthcare wider. So I think that's something to avoid.
One of the things I found really interesting was looking at your personal data and selling it. That's something I just hadn't considered before, and it's obviously a really big aspect and it's going on in the background, and I don't think it's really came to the forefront yet. So that was interesting. And secondly, just looking at the different wearable technologies, and particularly the ones that are already in the marketplace, and there is some fantastic work out there, and it is really interesting to see what's going on.